All right, we will move from forceps to vacuum extractor. Vacuum extractor is being used much more today because the experience with forceps is getting less and less. So most operative deliveries today use a vacuum extractor. This is a silastic plastic cup. It is placed on the fetal head like this. A suction is created using a pump or some other device, and when the mom pushes, you pull. What if the strength of your pulling exceeds the vacuum? Pop! The vacuum extractor pops off. I can't think of too many good things that happen to the fetal head when you have the pop-off. And so you want to be careful as you're pulling that your traction does not exceed the suction. Various different kinds of manufacturers, different sizes of cups. This is a tiny one called a Kiwi vacuum extractor and has a hand pump which you can use anywhere, even without electricity. Here's how it works. You put the cup on, create the vacuum, and you notice how it basically allows the head to follow the normal extension, internal rotation, as it comes underneath the pubic bone. The main indicator for vacuum extractor use is prolonged second stage. A poor electronic fetal monitor's tracing, avoid pushing, very similar to the forceps. A potential complication with a mother, if you're not careful, as you create the suction, you can entrap the vaginal mucosa inside of the cup, and when you pull it, I've seen half the vagina denuded. You've got to be careful as you do this to make sure the vaginal mucosa is not wrapped around. In terms of the neonate, particularly because of the injury to the scalp, you can have a cephalhematoma. That blood, as it is released and broken down, can release then bilirubin, and you have jaundice. Our head of neonatology at Loma Linda University Medical Center has told me he would much rather see a good forceps delivery than a vacuum extractor delivery because of these effects on the head. Now, this is an old picture of the metal cup that used to be used. We don't use that anymore, but you can see it can create injury. And the concern, even with the new plastic one, is you can have a cephalhematoma, which is potentially capable of causing intracranial pressure increases. This is a caput succedaceum. And this is just scalp edema, not a problem. But if you get blood, which can compress the head and intracranial pressure, you can have serious morbidity to this baby. The Food and Drug Administration in 1998 sent out this bulletin warning about subgaleal hematoma and intracranial hemorrhage because of vacuum extractor use. This is my old anatomy book, and you can see the area of subgaleal bleeding, which is called the dangerous area. So even vacuum extractors are not without their risk. And here you can see this hematoma on an autopsy specimen. Here we see the caput, here we see the cephalhematoma. 3 pulls, 3 hours of pushing. Don't extend a vacuum extractor beyond that. And that's the end of vacuum extractor.